2.1 describe the roles and responsibility of radiographer. A radiographer plays an important role in ensuring safe and proper radiological examination, such as ensuring patient care, image quality, and adherence to safety protocol. The role of radiographer before radiological examination is patient preparation. For example, verify patient information, explain the procedure, assess the patient history, and give instruction to the patient. Next, equipment preparation such as test the machine, provide accessory, and make safety check. Lastly, safety preparation like ensure radiation safety for patient and make agreements and legal documentation. The role of radiographer during radiological examination is patient positivity and comfort. For example, ensure the position according to the types of examination and provide reassurance and guidance throughout the procedure. Next, operation of imaging equipment such as use technical equipment properly and check the equipment to capture high quality image. Lastly, professional interaction like have communication with the patient by providing instruction on breathing. The role of radiographer after radiological examination is patient care and post-examination assistance. For example, provide guidance and support, and then should monitor the patient. Next, image review and processing like make an initial image assessment and make an image submission. Other than that, documentation and reporting like do record keeping and communicate with radiologists. Lastly, quality assurance and follow-up such as do quality control and give feedback to the patient.
Hello guys, my name is Nuraki Sumaira binti Mahdi. So now I want to explain about the principle of medical ethics and professionalism. So the first principle radiographer should have in their own self is they must provide service without discrimination such as age, sex, race, religion, status, and the disease. As a radiographer, providing service without discrimination is essential to uphold ethical, legal, and professional standard. So the other point is radiographer need to continually improve their knowledge and skill by participating in educational and professional activities. It is so to ensure they provide the highest quality of care and remain effective in their roles. For example, is keeping up with technological advance. Radiographer is a technology-driven field with constant advancement in imaging equipment, technique, and software. So, last but not least, radiographer must provide service to the patient with full respect because it is a fundamental duty of radiographer because it upholds the dignity, right, and trust of patient.
Hi, my name is Nur Emilia Umairah and I'm going to explain to you guys about the Code of Medical Ethics. The definition of the Code of Medical Ethics is a set of principles of conduct within an organization that guides decision making and behavior. The purpose of the code is to provide members and other interested people with guidelines for making choices in the conduct for their work. For the first one is professional. It means that physicians should maintain high standard of professionalism, honesty, and integrity in their practice. Physicians also should provide truthful information to patients and colleagues, avoid conflict of interest, and report unethical behavior when it is observed. The second one is morality. Morality plays a significant role in code of ethics, serving as the foundation for guiding professional behavior in healthcare and other fields. It provides a framework to ensure that action and decision are grounded in ethical principles and uphold the dignity, rights, and welfare of individuals. The next one is good communication with patients and their family. Effective communication is a cornerstone of quality healthcare, ensuring that patients and their families are well informed, supported, and engaged in decision making. It fosters trust, enhances understanding, and improves overall outcomes. So, for the next one is practice radiation for patients, staff, and the public. Radiation protection is essential in medical imaging and therapy to minimize exposure to ionizing radiation while ensuring diagnostic and therapeutic effectiveness. It focuses on safeguarding patients, healthcare staff, and the public from unnecessary radiation risk by following established safety principles and protocols. For the next point is protects patient's record. Protecting a patient's record is a fundamental ethical and legal obligation in healthcare. It ensures the integrity and availability of sensitive medical information, fostering trust between patients and healthcare providers while following privacy laws and standards.
Hello, my name is Nur Farah Jida binti Muhammad Nasir. Today, I would like to present about medical ethics and professionalism. Medical ethics refer to a set of moral principles and guidelines that healthcare professionals follow in their practice to ensure that they provide the best possible care to the patients while respecting their rights, dignity and well-being. Actually, we have four ethical values. First of all, we have autonomy, which is the obligation to respect patients as individuals and their right to make informed decisions. Second, beneficence. The ethical duty to act in the best interest of the patient. Third, non-maleficence. The principle of non-maleficence is the principle of do not harm by preventing any unnecessary harm or suffering. And last, justice. The commitment to treat all people fairly and equally to ensure equal access to care.
Patient right, healthcare access without discrimination. Every patient has the right to receive medical care and treatment regardless of their age, gender, nationality, religion, ethnic origin, or physical, mental, and social circumstances. Second, consideration, dignity, and respect. Patients should always be handled with dignity, respect, and consideration. This right guarantees that medical professionals continue to act with empathy and compassion. 3. A secure setting. Healthcare organizations have an obligation to provide facilities that adhere to the strictest safety regulations. 4. Information availability. Patients are entitled to comprehensive information regarding tests, diagnosis, therapies, and outlooks. The last is taking part in the making of the decision. In a collaborative healthcare approach, patients and doctors have to work together to decide the treatment.
It's me again. So now I'm gonna explain to you guys about identify the sources of the patient for radiological examination. Actually, there are many of the sources of the patient for radiological examination, but I'm gonna explain some of them to you guys. My first point is hospital inpatient. Patients are admitted to the hospital for treatment or observation. Patients who are formally admitted to the hospital and require treatment over an extended period, typically overnight or longer. For the second point is outpatients. Patients who visit the hospital or radiology department for diagnostic tests or treatment without being admitted as patient. So, the patient don't need to stay at the hospital for overnight or longer. Outpatient typically attend scheduled appointments for imaging procedure, for example, CT scans, MRI, or ultrasound. My last point is emergency department patient. Patients present to the emergency department urgent or critical condition that require rapid diagnosis and treatment. Imaging is performed promptly to support the diagnosis and management of life-threatening or acute conditions. Common scenarios include trauma cases, stroke, and abdominal pain.
The patient registration process and distribution of examination in medical imaging department. The first one is registration process. First contact and scheduling. Second, on-site checking. Third, consent and preparation. And the fourth, verification and confirmation. Distribution of the examination. First, assigned to imaging modalities like CT scan, chest scan, CT scan. Second, scheduling and workflow management. Third, patient preparation and guidance for examining. 5. Management and reporting of data.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Batusha binti Ariano. My part is identify the types of X-ray room examination based on types of examination. First is mammography. Mammography is a low-dose X-ray used to screen and diagnose breast cancer by detecting abnormalities in breast tissue before symptoms appear. 2 is fluoroscopy. Fluoroscopy is provide real-time imaging of moving internal organs and tissues using pulse X-ray display on a computer. Number 3 is computed tomography. CT scan use a series of X-ray and advanced computer imaging to produce detailed views of bones and soft tissues for diagnosing injuries and diseases. Number 4 is MRI. MRI uses powerful magnetic field to create cross-sectional image of the body, offering detailed views without radiation. Ultrasound employs high-frequency sound wave to produce image of internal tissues, making it a safe and radiation-free option, especially for pregnant women. Okay. Number 6 is bone densitometry, measures bone density to diagnose osteoporosis and assess the risk of fractures. And lastly, angiography. Angiography use X-rays and contrast material to visualize coronary arteries and detect blockages, often for patients with chest pain. All special examination such as intravenous urography, IVU, fluoroscopy, CT scan, ultrasound, MRI, mammography, interventional radiology, and DESA need appointment date. The appointment date will be given by the appointment X-ray clinician based on priority and availability of appointments slots where the special examination relevant disciplinary specialist must verify application. The appointment date is also given depending on confirmation status provided by the radiologist. The referring specialist or medical officer must discuss with the radiologist first if the examination is urgent and needs to be done immediately. Thank you.
13.5 Describe an appointment system for inpatient and outpatient. Inpatient means that you are admitted to the hospital and you stay overnight, while outpatient means you are not admitted to the hospital and you do not stay overnight. The appointment system varies for inpatient and outpatient. For inpatient are usually given priority. The appointment system are coordinated between ward and may require monitoring by medical staff. For outpatient are often booked in advance by radiology reception or an online booking. The appointment system are usually arranged based on patient availability. Some facility accommodate walking patient and receive preparation instruction during appointment scheduling.
To present about preparation before doing radiological examination. Before your radiological exam, there are a few important things to keep in mind to ensure that procedure goes smoothly and safely. First, make sure to share your full medication history with your doctor, especially any existing health condition like kidney disease, diabetes or asthma, as they can affect how image turn out. It's also important to mention any allergies you have particularly to contrast agents such as iodine or gadolinium, as they are sometimes used to improve the clarity of image. If you have any implant or like pacemaker or joint placement, let your healthcare provider know. Some image tests, especially MRI, use strong magnetic field that can interfere with or be dangerous for this device. Before the exam, you will need to remove all the metal objects, including watch, eyeglasses, and hairpin, because metal can cause disruption of the image. You may also be asked to wear a hospital gown to avoid interference from zipper or button your clothing. In some cases, you will need to follow specific fasting instructions. For example, you are having a CT scan with contrast or abdominal ultrasound. You may be asked not to eat or drink several hours before the exam. On the other hand, some exams like pelvic ultrasound require you to drink water ahead of time to fill your bladder. So be sure follow this instruction carefully. You also need to discuss any medication that you currently taking with your doctor. Usually you can continue your regular medication, but in some case, certain medication might need to be paused for the test. And if you experience any pain, especially to the area that we need to take image, let your healthcare provider know. They can make you more comfortable during the procedure.
So now, I want to explain the patient care before, during and after radiological examination. Before the examination, preparation is crucial to ensure the patient is ready for procedure, understand the process, and feel at ease. First thing radiographer need to do is check patient identification and verify. In brief, confirm the patient identity using at least two identifiers like name and date of birth. And at the same time, verify the referral from imaging request and clinical history to ensure the correct procedure is being performed. Radiographer should give preparation and instruction. For example, provide instruction on fasting, hydration, or contrast agent preparation if required. And then, radiographer must guide the patient to remove their jewelry, clothing, or other item that might interfere with imaging. Ensure the patient is physically prepared. During the examination, radiographer must focus on ensuring the procedure is performed safely and effectively while maintaining patient comfort. For example, position and safety. Position the patient correctly to ensure high quality image and minimize the need for repeats. And the most important is radiography must do communication. Maintain clear communication with the patient throughout the procedure, providing update and instruction. So, the last step for examination is after examination radiographers. Proper post-examination can ensure patient safety and set the stage for further medical management. And debriefing instruction. Inform the patient when the procedure is complete and what to expect next. For example, provide specific post-procedure like documentation. Document the procedure, including any patient reaction, contrast usage, or deviation from standard protocol. And the last is follow-up guidance, like advise the patient on when and how they will receive the result.
Hello, my name is Nuaina Afika, and I will be explaining about Hospital Information System (HIS) and Radiology Information System (RIS). Okay, HIS is an integrated information system that operates to hospital administrational needs such as collecting, storing, and retrieving overall patient's data. Okay, I'll be giving you an example. When a patient arrives at a hospital, their personal details, medical history, and insurance information are entered into the HIS. From there, doctors, nurses, and healthcare staffs can easily access this information. Okay, it also allows for seamless communications between departments, improving the overall patient care and the efficiency of workflow. Okay, that's done. I'll be explaining Radiology Information System. RIS is an integrated digital system used to manage medical imaging data specifically for the radiology department. Okay, so RIS helps store, track, and retrieve images such as X-rays, CT scans, and MRI that provides systematic information flow. Okay, so an example, when a patient requires an imaging test, their details are entered into the RIS, and the system schedules the procedure. Once the images are captured, RIS links the patient's records to the images and ensures they are accessible to radiologists for interpretation. The RIS also allows for seamless integration with other systems such as HRS and PACS, which we will be explaining in the next one, to store and display the images. Hello again. My name is Nuaina Afika, and I will be explaining the Picture Archiving Communicating System (PACS). PACS is a medical imaging technology that allows medical images to be transmitted, stored, retrieved, and displayed in various locations of a hospital or a health system. Traditionally, these images were stored in film, but PACS allows for digital storage, which allows for quicker access and easier sharing between doctors, radiologists, specialists, and other healthcare providers, regardless of location. Okay, so PACS also integrates with other hospital systems, like we had mentioned in the other slide, such as Radiology Information System (RIS) and Hospital Information System (HIS). It ensures the patient data and medical images are linked and easily accessible in one unified system. So, for your information, additionally, the universal format for PACS image storage and transfer is DICOM, Digital Imaging and Communications in Medicine. So, as you can see in my diagram that is in my current slide, right now, it's a simplified way of how it works, how PACS works. So that's all from me. Thank you.